Good afternoon, Lisa Homa here. Hope you're all having a great day. Today we're going to be talking about comfort in nursing policy. The outcomes for this lecture are to familiarize our students with our program's theoretical underpinning and to talk about holistic comfort theory and apply this to policy. The RN to BSN program's theoretical framework is holistic comfort theory. We considered many theoretical frameworks, but the most suitable theory clearly is holistic comfort theory, and I'll share a few of those details on why we selected it. It's a theory which will provide structure to ensure that our students meet student learning outcomes. So why holistic comfort theory? Well, if you were not aware, there is infamy with BSN programs. Nationally, statistically speaking, and from the literature, BSN programs are the #1 most stressful baccalaureate program in the country. Were you aware how stressful it is to become a nurse and get a BSN? The student experience described by many of our students who are coming into our program in their diploma or their associate's degree is that the experience in intimidation, so much so that they didn't want to return to school for another degree. It was such a huge burden that they couldn't bear the thought of going back. They're fearful. They endured unbelievable stress, no family balance, constant anxiety, and extreme competition among classmates. They have coined the entire experience exhausting. So the goals of our RN to BSN program are to create an environment where learning is a partnership between the student and the faculty, and there's mutual respect and trust. We are very pro-student, very student-centered, and we want our students to feel freedom from fear and coercion as safe learning environment. Dr. Catherine Kolkoba is the founder of Holistic Comfort Theory, so I'm just going to share a little bit about her so that you get a feel for her. She's a pretty incredible person, still alive. She was born on December 28th in 1944 in Cleveland, Ohio. She is a diploma nurse by training at St. Luke's Hospital. This is in Ohio. Got her BSN from Francis Payne Bolton School of Nursing. And then imagine being a PhD candidate, clin nurse specialist first, and then a PhD candidate in 1997. Currently, she's retired from the University of Akron College of Nursing. She's an amazing person. I have spoken to her, I've emailed, and she helped us to select the framework. What's amazing about her is she's, I think at least in her mid-70s, she's still traveling the country with Jean Watson. And if you're not familiar with Jean Watson, she's also a famous nurse theorist. And they're going into health systems and using comfort theory and caring to combine them into creating these great environments for our healthcare teams. Well, the other thing amazing about her is that she is married to an epistemologist. And that's also like a weird, crazy fact. An epistemologist is a way of knowing. It's a very specialized person, and he helped her create the framework for the theory that she created. And she did that as her doctoral dissertation project. Who does that, really? She's certified in gerontology. She started her career, worked in long-term care. So let's talk about holistic comfort theory. So in case you are unfamiliar with it, because a lot of theory books do not discuss this, it's a mid-range theorist. The definition of it is an immediate experience of being strengthened through having the needs of relief, ease, and transcendence met in 4 contexts of the experience. So in Latin, comfortare means to strengthen gently. The theory's propositions, and the reason we mention this is because you're going to see the direction and why this was selected for our BSN. So the healthcare team identifies unmet needs of the patient and family. The nurse and the patient work in concert, see another partnered relationship, to create a plan that meets the need of the patient and family to satisfy unmet needs. And we do this or accomplish this by using the nursing process. Comfort interventions are designed and operationalized. That means they're put into action, identifying intervening variables to overcome challenges and position for success. So then enhanced comfort is achieved when interventions are met in a caring manner. Patient, family, and nurse become motivated and psyched because all this stuff worked out, and then enhanced comfort is attained. Then because we're happy, then the healthcare facility gains recognition. People want to come to that healthcare facility, and they're satisfied with their healthcare delivery experience. If you can see this, it's a layered experience. So the patient experience is the center of care, and everything builds on top of that, and that's one of the reasons we wanted this for our program. 3 basic assumptions of comfort theory: Human beings have a holistic response to complex stimuli. Comfort is a desirable, holistic outcome that is germane to the discipline of nursing. They just match, they just go together so beautifully. And human beings strive to meet or have their needs met. 3 attributes of comfort itself. So we talk about these attributes quite often. We talk about relief, which is when your needs are met. Ease is the state of being content, and transcendence is rising above one's problems or circumstances. So let me give you an example of transcendence. So if I'm a patient, a surgical patient, I just came out of the OR and I have tons of post-op pain, I probably in that moment can't think about anything except how bad my pain is. I don't care about eating. I don't care about anything. But once I get pain medicine and my pain is controlled, I now rise above that situation and I can think about other things that are happening. The attributes can occur in any or all contexts, all happening at the same time. So then there's contexts of comfort. So then there's 4 domains of comfort. There's the physical, the body. That means like, if we're in pain, we want our body to be comfortable. There's a psycho-spiritual or an emotional component of that. We want our psyche, our spirituality to also be comfortable. Our socio-cultural is that comfort in all those areas, relational, social, and cultural. Environmental, we want external circumstances, comfort to feel safe around us. And this is a measurement tool for comfort. And we'll be applying this to a scenario here so that you can see how this works. So now we're going to apply it. We used an example of what it is like for you as a student. We applied what all your stress was compiled into this matrix. So basically, as a student, I may have a headache, I could be anxious, irritable, and I don't get any sleep because I have too much homework. In the psycho-spiritual domain, I'm not relaxed both mentally and spiritually. Environmentally, I could have a poor study environment. I could have kids that are driving me crazy and need help with other things before I get to do my homework. They could be distracting me constantly. I could have improper temperatures because maybe I had to move to another part of the house or wherever it is that I live in order for my kids to not drive me crazy. Socio-cultural, there are just too many demands. And this is what we hear about our RN to BSN students, is that there's too many competing priorities. I could have financial strain trying to afford school and lack of support, meaning a spouse or someone who can take the burden of the kids off you so that you can get your schoolwork done. So if we apply the theory to our BSN students, look at what we can do. So under the relief domain, identify detracting factors and remove as many of those factors as possible, and then relieve physical pain in any way that we can. In psycho-spiritual, we want to identify causes of the feelings, reach out and try to provide support. We do that with our dedicated admission and advising structure. We take in elements, let's say environmentally, we want to promote a healthy work environment for you. So that's taking breaks every hour or whatever you can do. Socioculturally, if you are really having a lot of things happen in your life, we want you to take a subterm off. Ease, we can see this applied in our program and our framework by using proper ergonomics. So we don't want you to hurt your back. So we'll teach you that. We want to talk about healthy food, taking care of you, yourself personally. And then for the psycho-spiritual, we want you to seek counseling if you need it. Anything we can do, prayer, anything in those aspects to make your experience better. Environmentally, can any of those conditions be adjusted? What can we do, again, to support you? And then socioculturally, is there a support person, someone you could vent to, or someone like faculty, an advisor to help you problem solve? Under the transcendence, we help you in the physically to make a schedule that works better for you. So we want you to work smarter, not harder. We will work on teaching mindfulness. In the psycho-spiritual domain, we talk about guided imagery, self-esteem, faith in oneself, meditation, and we provide a lot of inspiration by reaching out to our students frequently. Environmentally speaking, we want you to make small adjustments where you study if possible. Can you do homework with your kids together? That's what I used to do to try to get through school, is have my kids do homework with me while I'm doing my homework. Socioculturally, structure schedule to manage demands. Additional comfort measures that we can do to help our BSN students. Let's say relief. If you're cold, make it warm. Explain plan of care to decrease anxiety. Provide coaching. These are just some examples. A private room for end-of-life care. So these are things that we could do for our patients. Sociocultural and psycho-spiritual. We can offer a chaplain, pastoral care, and be there to support the family when needed. And like physical things, back rub, turning reposition, pain meds, secretion management, and end-of-life care, things of that nature. So of factors that affect how a patient receives comfort. So these are intervening variables. So maybe they had a horrible experience in the past and now it impacts their current experience, age, finances, attitude, acceptance of the state of health, support system, prognosis, and emotional state. And maybe you can relate to all of those. This is usually intended for patients, but maybe you can relate to those being a BSN student. Hopefully not all of them. The goal of the theory is for everyone within the healthcare system, patient, family, nurses, healthcare team, to be satisfied with comfort, engage in care. We want the patient to feel good and a higher level of function for our nursing teams, reduce readmissions, improve patient care and outcomes and satisfaction, improve nurse retention, and provide a framework to guide delivery and optimal care and outcomes. And then we also know that when this theory works amazingly enough in a health system, stronger cost to benefit ratio for the health center. We know that it's underpinned with the famous nursing meta paradigm that Florence Nightingale came up with: nursing, person, environment, and health. And how do other cultures perceive comfort? So this is one of the things we're going to talk about in every one of your courses. What are the criteria for comfort? Some cultures don't believe that we should be comfortable in childbirth or other things, so it's important to understand that, because maybe we're trying to intervene in an area where we should not. And there also needs to be a readiness for enhanced comfort. Some cultures believe that pain is a result of punishment or sins or wrongdoing. So again, we don't want to intervene where we are not supposed to or we don't understand. So we have to find that understanding by understanding the culture. And then we could have, again, impaired comfort. Comfort in policy, we're applying this to your levels now, is that nurses are the largest group of healthcare providers in the world, means that we have the most potential for greatest impact in improving policy, making policies relevant and meaningful to the workflow that only we understand. Our lawmakers don't get it. They are clueless and they do not understand what it's like to be a nurse and the day in the life of a nurse every day. Nurses experience the effects of and impact of policy and politics in healthcare. They understand, they see it happening, impacting patients, the community, and in the healthcare surroundings. The role of the nurse in policy. So for individual health, nurses have the key role in understanding, identifying, responding to barriers that prevent people from being as healthy as possible. And they also get this great preview of health disparities because often they're interwoven and discovered during care activities. Remember, healthcare is complex. It's not easy, and it usually comes layered. The role of the nurse in health policy for the population health, vote with a focus on population, is nurses at the point of care are best suited to advocate for resources, services, basic provisions, and education. Only you know what's best and what type of education that our patients need. And that could be for the community in general or just for the specialty. Maybe you work in a specialty area. And for staff health, nurse leaders, great nurse leaders, use their skills to help teams to function better, to promote a healthy work environment, to promote better care and outcomes, to fight for safe staffing levels, and promote personal wellness for nurses. Since the pandemic, there's this huge push for personal domain because so many nurses have left the field during the pandemic and now, I guess, sort of after. And then what can we do as a nurse to shape health policy? So there's a couple things. We can learn, one, how policy is made. So we're doing that in this course. We know who makes policy in the workplace and in the community. You can inform them and share your insights with community leaders. Explore which health policies matter most to you in your workflow and your patient population that you serve. The role also, we can shape policy by investigating which legislator supports policies of interest for you. You can write to your legislator about issues impacting patient care. You can inform colleagues about opportunities to influence policy change, and you can join organizations that lobby on behalf of patients or nurses. So that's all we have for now. Thanks for listening. Welcome to the program, and keep us informed with how things are going for you. Have a great day.